We're now looking at needling, and again my disclaimer, please do not proceed to do either of these techniques if you are not properly certified in your state or in your country. We're going to start with dry needling, which is using an acupuncture needle and an introducer. The pec minor, it is in tiger country, because just underneath the pectoralis minor are your ribs, and then just deep to that is your lung. So this is an area where you can definitely, if you go too far, you will cause a pneumothorax. There are two ways that you can get around this. The first is you need to be very clear where the ribs are. So if you've got your rib as a base, so if I'm going to treat the more common trigger, which is in the joining of the two lower divisions of the pec minor, it's just here. It often actually overlies a rib, but you can't rely on that completely. So if what I do is I feel for and find the trigger. He lets me know when the trigger is there. I press down to make sure I know where the edge of the rib is. The rib is, I can feel I've rolled off it there and I've rolled off it there. Now, depending on the size of the chest wall, I could be quite a lot higher, or someone with a very thin chest wall, I can feel it very easily. You need to be sure, because the pec minor is deep and it's just right over the ribs. The first technique is that I have my finger directly on the trigger point. I then straddle it, put my introducer on the skin, drop the needle, give it a quick tap. It's now sitting just through the skin, and then I progress forward. I press down to get rid of all the tissue, as much of the tissue as I can. I've got my finger on either side of the rib. I pop through, I carry on down, and I feel for the rib itself. So I'm going straight down, using my fingers as a guide, having a sensation in my mind of how far down the tissue, what is my safety. If I push way down and I've got 2 centimeters in someone with a big chest, or if I've got just half a centimeter in someone with a small chest. I go down very carefully, having worked out the distance, my safe distance, and I make sure that my needle doesn't go further than that safe distance. I go down until I strike the trigger, and I know I've struck the trigger because I will feel needle grasp. I may feel the muscle jump, or he may say, ouch. Once I'm in the trigger, I give the needle a little twist, and then I just leave it there for 10 minutes and take it out. So that's the first technique, where I use the rib at the back as safety. The second technique is that I come from off the trigger, and so normally I would come inside the trigger, again feel for the rib. I know the trigger is lateral to me. I again tap, put the needle in, and now I search, but I come I go at an angle. I know that the ribs are going round like this, and I'm going to go tangential to the ribs. The positive side of this technique is that I'm much less likely to go too deep. The negative is that my ability to find the trigger point isn't quite as good, because I'm not directly aiming down for the trigger, but I'm coming from an angle. However, I can still search backwards and forwards and search in this zone to see whether I can find the trigger point. So this is a safer technique, but it is slightly more difficult to find the trigger.